Good evening, everyone, and welcome to Special Education Legal Fund's March webinar. Boy, I'm starting off strong. Here on anxiety, mental health in school. My name is Christine Lai, and I am the executive director and co-founder of Special Education Legal Fund. So welcome. First of all, I'd like to welcome our corporate sponsors, without whose support so much of what we do is not possible. Tonight's webinar is sponsored by American School for the Deaf. Founded in 1817, the American School for the Deaf was the first permanent school for the deaf in the United States and is a nationally renowned leader in providing comprehensive educational programs and services for deaf and hard of hearing students. Thank you, American School for the Deaf. I'd also like to acknowledge our other sponsors. At the platinum level, Wealth Spire Advisors. At the gold level, Winston Preparatory School. At the silver level, in addition to American School for the Deaf, we have the Eagle Hill School, Fusion Academy, Villa Maria School, and Chapel Haven Schleifer Center. And at the bronze level, we have our friends at Pinnacle School and Spire School from the Greenwich Education Group, as well as Shrub Oak International School. So thank you to all of our sponsors. We could not do what we do without your support. For those of you who aren't familiar with us, I'll just take a little moment to talk about Special Education Legal Fund. Special Education Legal Fund was founded in 2018 to provide resources, knowledge, and support to families in need with children in the special education system. We do this predominantly through two grants programs, the Legal Assistance Program and the Advocacy Support Program, through which we provide financial support to families in need in Connecticut and Westchester County. The Legal Assistance Program, which is for attorneys, provides families in need with up to $6,000 in legal support from a qualified special education attorney through a competitive grants process that runs on a monthly basis throughout the academic year. The Advocacy Support Program provides families in need with $1,000 in advocacy support from a qualified non-attorney special education advocate. This program also runs on a monthly basis throughout the academic year. And for more information to begin the application process, you can visit our website at www.spedlegalfund.org and just click on the button that says apply for the grant. Also, you could use this QR code, which is on the screen right now. The grants process, just to recap, has 4 parts. The pre-screen, which you do on our website, when you click on that apply for a grant button. The application, which you will complete, you'll receive an email after the pre-screen is done, and you will complete the application online through a link that's provided in your email. At that point, once you've completed the application, you will sit for an interview, a 45-minute phone interview with a member of S.E.L.F staff. And after that, we notify families at the end of the month in which they apply. Next month, we have a full schedule of webinars. We're super excited. On April 24th, we're going to talk about preparing for college for students that have IEPs, 504 plans, or who are enrolled at independent special education schools. This is a topic that is near and dear to my heart, having a son who with Asperger's syndrome who, worked his way through the school system and is now currently in college as a freshman. So I'm really excited to have this panel to talk about not only what, accommodations that, students have in college, but also accommodations in high school, testing strategies, what classes to choose, study strategies. And we're really, really excited to welcome attorney Marion Walsh from Littman Crooks, as well as Danielle Meyer from the Harvey School, Amanda Sylvester from Fusion Academy Fairfield, and Steph Sabar from Winston Preparatory School. So that is on April 24th at 7 p.m. You can register the same way you registered for this webinar or use the QR code that's shown here. Next month, we also have 2 upcoming school showcases. We just had one today with Winston Prep. So if anyone is a parent or professional that's looking to learn more about a special education school, in this case, the Pinnacle School on April 11th and the Spire School on April 25th, please join us. It is really, for me, it's great fun to explore in depth what makes each one of these schools different. We take you on a little virtual tour, and we have an interactive Q&A with members of, the school's senior management. For Spire, it's Charlie Manos, Daniela Rosenblatt, and Stephanie Kriegsman. And at the Spire School will be Dr. Tammy Moscrip, who's here with us tonight, admissions director Didi Lacombe, and Alyssa Corsaro. So we're really, really happy to have both of these, these showcases in the month of April. Finally, last but not least, we are getting ready to start our panel. And I'm really, really excited to welcome Dana Jonson back to the S.E.L.F. webinar series. You are a 5-timer, actually. I went through and counted before the call. You've done this mental health webinar, the previous mental health webinar. I think attorneys and advocates, what's the difference? IEP versus 504 plan. Anyway, I guess like I should have a jacket for you or something, but or in therapeutic schools, you did that one too. Yeah, if this were Saturday Night Live, there'd be a jacket, but there isn't. So welcome back. We love Dana, and we're really happy to have her back for this webinar. Dr. Tammy Moscrip is joining us from the Spire School, from Greenwich Education Group, where she's the executive director and also the clinical service director for Greenwich Education Group. You are a 3-timer. This is your 3rd go round on a S.E.L.F. webinar. In addition to this mental health panel, you've also appeared on approved and non-approved schools, as well as therapeutic schools, I believe, with Dana. So we're really, really thrilled to welcome Tammy back and to hear her perspective on, supporting students with anxiety and mental health challenges in a school setting. So welcome back, Tammy.
Thank you for having me.
And finally, as we round out my this panel of my favorite people in the world, Dr. Adrienne Smaller, certainly on that list. Dr. Smaller and I have known each other for a very, very, very long time. And you are also joining the 3-Timers Club. You've done this one, the other mental health panel, and then the webinar we did on IEEs, which was amazing. Dr. Smaller is an assistant clinical professor of psychology at Yale Child Study. She's a private practice in Madison. She is an exceptional evaluator and advocate for children and families. I really can't say enough about Adrienne's, just insight and thoughtfulness around, children and, and their, and developmental disabilities and, and the challenges that our kids face at school. And I'm just thrilled that you're joining us again this evening for what is, obviously a very, very important topic that we're going to talk about tonight. So welcome back, Adrienne. Thanks for being here.
Thank you.
And just to do the disclaimer, because that's what we have to do. This webinar panel is presented for informational purposes only. This webinar is intended as a resource for families who are navigating the special education system in Connecticut or New York, and is not intended to provide legal support, advice, or assistance to any particular individual, nor is it intended to replace the advice and counsel of a qualified special education attorney. Families in need of legal advice, support, or assistance should contact a special education attorney licensed to practice in the state of their residence to discuss the specific needs of their individual student. This webinar should not be construed as an endorsement by Special Education Legal Fund or any of its representatives of any of the participating attorneys, advocates, or other professionals in the panel, nor should it be construed as an endorsement of any school or school representative that is invited to appear on this panel. So, welcome everyone, as I try to stop this sharing. There we go. So it seems like it's a little bit repetitive to talk about being in the midst of a mental health crisis, but we are in the midst of a mental health crisis among our youth. And, I know that, at S.E.L.F., we have seen a tremendous increase in the number of families that, and children that come to us presenting with significant mental health challenges and difficulties, even versus a few years ago. And even since the start of the pandemic, actually. Some of those challenges obviously exist, hand in hand with other, learning disabilities and challenges. And some of them, have emerged, recently, as a result of the pandemic and everything that, our students have been through. So we've convened this panel to talk about these challenges and to talk about what you guys have seen in your fields, and in your sort of very different fields in the last few years, and also to help families and maybe provide some guidance in terms of what resources are available for families who are struggling with this, and even, how to begin, really at any stage of the journey. So, with that being said, Dr. Smaller, I want to talk to you. I'd like for you to talk a little bit first about, anxiety, because that's, kind of what we're leading off with. Um, you know, can you talk to us about the different types of anxiety
Sure.
and amongst, students, and also how they might present differently in children of different ages?
Sure. And I have to say that, the last 4 years, and I can't believe it's been 4 years,
Yeah.
but has challenged our field tremendously, just in terms of trying to meet the needs of children and families. We were faced with something we never, ever experienced before, never, ever anticipated, and it certainly has taken a toll. And I feel like we're still kind of in the throes of it. And it's just, as adults, we were, all of us who were fairly well put together were challenged by the everyday experiences in terms of what we went through. And for the first time in the last year or so, when I write a report or when I take a history, I have to take a COVID history of
Hmm.
that child.
Hmm.
So we have to go back 4 years and say what happened on March 13th
Hmm.
to this child. So it's very much with us, and not that we want it to define us, but I think that we're still reeling from that experience.
Hmm.
So that any child who is wired somewhat differently in terms of an anxious child, or a child who kind of looks at the world half empty, has some sort of depressive kinds of traits, it feels like this kind of shattered, this sort of triggered a lot of issues for kids who already had that kind of vulnerability. So, in terms of anxiety, it does present slightly different in children than it does in adults. And we have sort of four, almost five categories that we look at. And one is the generalized anxiety disorder, which means that a child is afraid of everything. So it could be, depending on their age, it could be just loud noises. It could be driving in the car, not wanting to go on the highway. It could be leaving the house, even going upstairs alone or going downstairs alone. Going to sleep at night can be challenging. So, bridges, tunnels, escalators, loud noises, all of that kind of triggers a child and sort of throws them into a lot of behaviors that they use in their attempts to sort of cope with what may be unpredictable or uncomfortable.
Hmm.
There's also social anxiety, which is just the fear of being in groups, standing up in front of the class, fear of going to the choral concert and being on stage. It can be just not wanting to go to soccer, not wanting to go to church, just this idea that anything outside with peers is uncomfortable and that they'd much rather be at home, and that what we hear is that parents say they're fine at home.
Hmm.
And so what happens is that their world becomes much smaller
Hmm.
when we're talking about social anxiety. And then we have separation anxiety. So that can start very early on in terms of being left with a caregiver, left at school, separating to go to grandma's, separating to go to school, and it could be just even separating to go to bed at night. That child has that kind of vulnerability. And then when things get pretty severe, we talk about anxiety attacks or panic disorders. So it's an extreme reaction to those kinds of fears, and a physical response to the anxiety. So it could be manifested in hyperventilating, it could be crying, shaking, tantruming. It's a sort of a fight or flight response. And then there's also the underlying obsessive compulsive disorder is
Hmm.
really basic anxiety. And it's an attempt to control the anxiety
Mhm.
by controlling the environment through rituals and or repetitive behaviors. So that we saw a lot of during the pandemic, and that there was a lot of checking of locks. There was a lot of hand washing. Still see a number of kids who are continuing the hand washing like we all did, but it sort of stayed with them and sort of
Mhm.
feeds that kind of need to, be assured that they're not coming into any contact with
Mhm.
germs. So it could be counting, it could be turning, it can be watching the clock, those kinds of
Mhm.
things. And then we also have the post traumatic stress disorder.
Mhm.
So after something that has been very traumatic, a child then continues to have those kinds of symptoms in
Mhm.
terms of flashbacks, nightmares, and agitation and depression and anxiety. In terms of depression, what I wanted to say was, certainly anxiety and depression go hand in hand. One tends to mask the other.
Mhm.
And that what you see in young children is that any changes in behavior, and that's what I wanted to say. If you're
Mhm.
seeing anything that's changed in terms of significant irritability, significant aggression, or withdrawal from things that they used to find pleasure in.
Mhm.
Any changes in behavior, and that could be in terms of sleeping, toileting, eating, those kinds of functions. Those are the concerns that we
Mhm.
would have. And the question is, when does the anxiety and depression interfere with daily functioning?
Mhm.
And that's when it's important to really discuss
Mhm.
those issues with pediatrician and so forth.
Mhm. How does it look, how does it look, in a teenager? How does this, does the behavior look, at that age? What are your sort of like red flags that you're looking out for?
So again, any changes, withdrawing from activities, not seeing friends the way they used to, sort of that withdrawal, that
Mhm.
real, we see irritability in teenagers, that's
Mhm.
sort of a get-go. But when it's really increased,
Mhm.
when you have a sense that there's nothing pleasurable, nothing joyful going
Mhm.
on in that child's life,
Mhm.
and so it would be withdrawing, or then it sort of then takes another spin in terms of really acting out
Mhm.
behavior. So that could lead to substance abuse, again, to just sort of cover or mask the feelings of
Mhm.
non-well-being
Mhm.
uh, and low self-esteem.
Mhm.
And that's pretty much what we see. We're
Mhm.
concerned about those issues in terms of eating disorders, self-harm, cutting, all of those things that are sort of manifestation
Mhm.
of a child not feeling.
Mhm. I mean, we're gonna spend a little time, I think, talking about school refusal, like as which is it can probably be its own whole webinar in and of itself. But what would you suggest to parents, in terms of taking the first step to help a child that's suffering from anxiety or depression?
So when you see those symptoms, and uh, and whatever you as a parent have tried to, there's spending quality time with your child, with a preferred parent or a non-preferred parent or a
Hmm.
relative, when you've sort of exhausted all of your bag of tricks, then I think it's really important. The first line of support is really to contact your pediatrician,
Hmm.
and they're experienced with, they know your family, they know your child, and then they have a list of referrals
Hmm.
if they feel that that's really the next step. And so then talking with a mental health professional, and what to expect at this point in time is long waiting lists. It's
Yeah.
really, that has not changed
Hmm.
in the last few years. But it's really important to, find somebody that is highly recommended to
Hmm.
you, and, really take the time. And it's usually a parents meeting with the professional first, and then the professional setting a schedule to meet with that child.
Hmm. And what do you do? I mean, how would you approach a child, or a child that you know is not open to receiving support?
So then it's really important that the whole family goes together. that there's some resistance to being what I call the identified patient.
Mhm.
And then just saying, we all need help with this.
Mhm.
We need to figure out a way to help you feel more
Mhm.
comfortable. And
Mhm.
we're all going to talk.
Mhm.
And so that seems to take some of the pressure off of that
Mhm.
child being identified.
Mhm. And, we're gonna, obviously, talk about, how this is a holistic problem for, for everyone to, to address. And I would like to talk, just kind of round out your, discussion a little bit about, sort of like, I don't want to say like, a series of steps, but, you've reached out to the pediatrician, you've reached out to, the child is receiving, therapeutic support, through a psychiatrist or a therapist or whatever. And your problem and the problem appears to be more serious than that. Can you talk about, the sort of escalated steps of support that, a parent can provide, can help their child achieve, whether it's, an IOP or an ICAP or ICAPS or all of those sort of, alphabet programs that, parents might not be familiar with.
So what you're really talking about is sort of level of
Yeah,
care.
level of care, exactly.
And so, and I go, when is it an emergency?
Mhm. Yeah,
So
when do you call the hospital?
when do you call the
Yeah,
hospital?
when do you
So,
call the hospital?
our bottom line as a clinician is when the child's harmful to themselves
Mhm,
or others. But I also feel like there's, harmful to themselves. There's an increase in concern about self-harm. They've made some suicidal statements. They, uh, have, had some gestures in terms of cutting
mhm,
or really unsafe behavior. That's really the bottom line.
mhm,
And then working with the child's mental health professional, then in my practice, then I say you gotta go.
mhm,
Uh, and what that means, you get a lot of pushback from parents. What does this mean? It's going to frighten them. It's going to terrify. We're going to traumatize them. And I really say that our main concern is keeping your child safe.
mhm,
It's a community responsibility
mhm,
to keep children safe from themselves. And so then it means either if the child's safe in a car driving to the emergency department, I, as a clinician, I usually call ahead to Yale and I say, I'm sending this family. These are
mhm,
my concerns, and that they're sort of alerted to that child. And what's the purpose of going to the emergency department is that you want a psychiatric evaluation of your child to sort of clarify, is that child safe? What's the next step in terms of a discharge plan,
mhm,
and that we can no longer guarantee his or her safety, so that you're going for a psychiatric evaluation
mhm,
in the emergency department. And if you feel that your child is not safe going in the car with you, then 211 or 911 would have to be called.
mhm,
So just to clarify for parents, 211 is without the sirens, but a
mhm,
mental health team comes to your house and does an evaluation and would either then take your child to the hospital or figure out another way to
mhm,
deal with it. And then 911 is the sirens. So that's, really an emergency. And I have to say that, the team who I've worked with here in Madison for many, many years, they're very well trained and are able to really sort of calmly and supportively help the family and help the child into the ambulance. And then they're received in the emergency department. What to expect in the emergency department? Um, Very long wait. So it could be 4 to 8 to 12. During the pandemic, we had families waiting 2 days to be seen, not to be seen, but to sort of figure out a discharge plan because there were no beds in the
yeah,
state. So it's not the end. It's
mhm,
really sort of the beginning of this
yeah,
process.
mhm,
But with the bottom line is that you need to keep your child safe. And that's sort of how we do it.
Mhm.
And it's at that point that the team then in the ED, working with your mental health professional, decides on a discharge plan and what that would look like.
Mhm.
So when we talk about level of care, it would be inpatient is the most restrictive environment.
Right.
And that usually is 2 to 3 days, depending. It could be a week. And again, it just depends on the child's presentation. And then following the discharge, the team decides whether that child would benefit from a partial hospital program, which
Mhm.
means usually about a half a day, 4 to 6 hours in a program,
Mhm.
or whether IOP, which stands for intensive outpatient
Mhm.
therapy, is usually something that's done after school. So it would be like a 2 to 3 hour program after a school setting. And or that child is discharged to their outpatient clinician.
Mhm.
So it really depends on the level of care. I know
Mhm.
that you mentioned ICAPS.
ICAPS, yeah. Mhm.
ICAPS is known as the in-house, in-home services.
Mhm.
So there are times when we can't get a child to move out to, and the family is in crisis.
Mhm.
Depending on where you're living, ICAPS is a state program where clinicians come into the house and help to sort of settle things,
Stabilize
organize,
the
and
situation.
stable.
Yeah.
Yes.
Great. That's super helpful. And again, I thank you for like, really laying that out, so clearly and and concisely for for our audience to understand. Um, you know, obviously this is a holistic problem that, the family and, needs to address, and also the school and the school district. So, I, have had, have brought, Dr. Moscrip and attorney Dana Jonson onto the call to provide both their perspectives on how schools and school districts can support students that are in crisis, that are suffering from anxiety, depression, other mental health challenges, and school refusal. So, one of the ways I think in which, it becomes most obvious that, because you talk about the changes in behavior and, and how anxiety and depression affect, daily living. And one of those, the most, obvious way that's, when I see it the most is when the child's refusing to go to school. And, the phrase school refusal just does not encompass at all, how awful and horrible it is, for the family and the student. So, so first of all, Dana, can you talk a little bit about how, about, the law and how the law applies to, a student in crisis, and how a law can help protect a student in crisis?
Sure. And I do want to echo what Dr. Smaller is saying, just the amount of mental health issues that are coming across my desk post COVID are ridiculous. I mean, it really is. And, I think there are probably a lot of kids who are just getting by
Yeah.
and were just flying under the radar,
Yeah.
and they were impacted. And then kids that probably weren't having any issues at all were impacted by it. So there's just a huge broad spectrum. I will say the one thing that is a plus, at least from my perspective, is there was a time when I had to really work hard to prove to a school district that a child's school refusal or mental health issues were impacting their education and needed to be addressed by either special education or a 504 plan. And just really briefly, special education is when a child has a disability and requires specialized instruction. And a Section 504 plan is when a child has a disability impacting their learning and just needs accommodations. So they're two different things. And this isn't the webinar for that, but I do want to throw that out, that not and there are kids who have disabilities who don't qualify for either. So, but there was a time when it was really hard to demonstrate to the school, to get the school to come around. And I don't have that battle anymore. But I think parents do. And I am seeing that a lot of parents are requiring advocates and attorneys to get any of these services. And that's not, I don't think because school districts have suddenly turned on us. I think they don't have the resources. They don't have the resources, they don't have the training, but at the bottom, or they don't have sufficient staff, right? So, but at the bottom line is, if your child's mental health issues are impacting their education, then you are entitled to something. And at a minimum, an evaluation to determine what that is. And I always suggest that parents look for evaluations to check for special education needs, because there are many more rights under the IDEA, which governs special education. And so if your child qualifies for that, I would strongly recommend going that way. This is not something that's going to follow them to college. So don't worry about that. That's a different problem. You'll talk about that next month. But, I recommend they ask for an evaluation under special education. I've had schools say, the kid's so smart and they're great when they're here. And I say, yeah, but they can't get here.
Right.
So you can't tell me this isn't impacting their education. There has to
If
be
they can't get into the building, it is impacting the education.
Something's not working.
Right.
And that doesn't mean that your child automatically requires a therapeutic setting, but they need something. Something is not working. And so from the legal perspective, you got to start with an evaluation. If you have an outside provider or someone like Dr. Smaller, have them write their components. A lot of children have therapists who will say, I have grave concerns about their ability to function in this building or in this environment, and something needs to happen. But even if parents are coming to the table with having done nothing else yet, they can come in and ask for an evaluation. And particularly when it comes to school refusal, there are a lot of things that schools can do. A lot of schools have alternate programs that work at different times of day. I know I have clients working with behavioral health services that come into the home and help work with the child to get them to school. Sometimes maybe getting them to the public school isn't what we're trying to do. Maybe this child needs a therapeutic setting. And suddenly when the child is in an environment that is addressing their needs, they are willing to go to school.
Right.
It's the size of the building. It's the lack of support. It's the lack of
could be the peer group. Could be the peer group.
Or lack of a peer group. That happens a lot. I do notice that I think a lot of children or more children, I should say, are coming out as transgender. I see that as a big deal, which I think is wonderful, but it's also very difficult, and it's difficult for them. And so I don't think these issues weren't there before. I think they're we're seeing them a lot more because kids aren't masking them as well, or they're not trying to. And those bring along a whole other host of issues. And I also see a lot of bullying that ends up in emotional issues that don't go away the second the bullying goes away. That's not how it works, right? So, for some reason, some kids can't get back into that building, and that's just never going to happen. And we have to address that. And what are we going to do? So there are a number of ways to address it. And Dr. Smaller.
I was going to say, one of the things that I'm just so appalled at, and maybe Dana, you could speak to it, that if a child is refusing to go to school and they've been out of school for more than 2 weeks, the family's entitled to what we call homebound services. Not done, and it's not done in the home anymore, but in an alternate setting. And I just had a case where the kid's been out of school for 9 months, and the district never, ever, about home, and they never offer it. It's something that you have to plead for, advocate for, find a safe space that your child is willing to go. To meet with a tutor, to just keep, because that just makes the anxiety. I've missed so much work. How can I go back? I can't, I can't do it. I can't. And that is something that the schools never, I think one school that I know of.
They rarely offer it. Parents have to ask for it. A lot of times when parents call me, I'm the first time they've heard of it. Why hasn't anyone offered this child homebound services? They've been out for over a month. It doesn't make any sense. But yes, you should be asking for homebound services. And there are some schools who actually have those services set up, maybe at the town hall or something. And it's part of their
library or whatever.
Or the library. It's somewhere other than in your home, usually. I do have some students who still do receive it in the home, but that's not standard anymore. It used to be that way, but it's not standard anymore. It really depends on the district and the situation. But yes, there are homebound services that you can ask for at a minimum to get started to figure out what your child needs.
Yeah.
Right.
Or just to keep you like, at a level, because I know that,
Right.
Obviously like the more school you miss, the more anxious you are about the school that you've missed. And then it
Exactly.
becomes like a spiral, and it's, and
Exactly.
you
Because then
can never
children
catch up. Yeah.
aren't just afraid of all the questions of where have you been
Yeah.
and why weren't you in school, but now they're afraid they're not going to even, be able to function in the classroom because
Right.
they've missed so much work. And
Yeah.
and the homebound tutoring is significantly less than a full day of school. It's like 1 to 2 hours a day,
Yeah.
but they're
Right.
one-on-one.
Right.
And you get so much more accomplished during that
Yeah.
one-on-one that it can
Yeah.
keep kids on track.
Yeah.
Right.
Or at least not falling too far behind.
Exactly.
Once you're talking about a therapeutic setting, Tammy, I'd love for you to, to opine on, how schools can support students with, anxiety and depression, particularly, obviously there's supports that are available in a public school setting, but, once a child's in a therapeutic environment, like the environment that you have in your setting, can you talk about how you support students in that, in that setting?
Sure. Yeah. So Spire is a small therapeutic day school in Stanford. We'll have 65 students. Generally, we have rolling admissions throughout the year, small group classes. So typically 4 to 6 students, generally no more than 8 in a class. So already entering the building, there's less chaos, there's fewer bodies, less noise. It doesn't have the same sort of sensory overload that you would have in a larger public school. Also, sometimes speaking to the bullying, right, it is changing the peer group. It's providing an opportunity to do a refresh. So those sorts of things already just entering the environment, students can do a sort of a big exhale and be like, okay, this is a little different. I think I can try this.
It's also empowering when you're in an environment, when you're in an environment where, other people understand your struggles as well. That is very, I don't want to say liberating, but, it can be, freeing for a child that has been, struggling under the weight of, of a situation that they think that they're the only one that's struggling with,
Right.
so that also is,
It's a comfort.
Yeah, absolutely.
Right.
And I
When
think
you-
just add to that is I think some students feel like it's their fault because a lot of times they are the one who are blamed, right? It's
Yeah.
they're just not coming.
Right.
You just need to be
Right.
stronger as a parent,
Right.
whatever the
Yeah, how many times have you
is
heard
that you hear.
someone say,
Yeah.
"Just get him in the car, just drag him into the car," it's like, it's
Yeah.
really not like that, that's
No,
really
that's not how
not
it works.
that's really not an option,
Yeah.
Yeah, so Aspire too. So that's the first part. And then it's about relationships, right? It's relationships with peers and providing opportunities, whether you start with us at the start of the school year or you come in through rolling admissions. We do transition programs, which can start one-on-one with the teacher if you're coming in through rolling admissions to help you catch up with the content in the group class. We can't imagine just plunking someone down, already a quarter into the class and think somehow they're going to catch up when inevitably, there's gaps,
Yeah.
there's going to be content and skill area gaps, there's going to be discomfort with transition. Generally, if you're coming to Spire, you get about 70 to 85% in any given year would be district outplaced, right? So a lot hasn't gone well for that student and family before they've come to be at Spire. So there's a lot of work to be doing, and it's helping kind of ease them into that environment and recognize you're not expected to know what to do here, right? Like it's our job to kind of figure out what your needs are, to identify gaps, figure out how we're going to fill those gaps, and then communicate, to your point, as a team, right? This really is a holistic approach. This is not about an individual that has to be fixed, right? One, not broken, but two, it's not just about the individual, right? There's a whole team, there's a family, school systems that have been involved in helping shape this child's experience. So it's about relationships with the teachers as well, right? It matters, speaking to the school avoidance, it matters that you're not in class because we miss you, right? You're an active contributor to the class discussion. When you have 4 to 6 students and you don't have, 20 to 26 students, your individual contributions to class truly are impactful. You help drive the curriculum. And so the fellow students, as well as the teachers, will make note of that in positive, supportive, encouraging ways. I think too, what's unique about our environment is that we don't remove challenges or obstacles or hard work. quite the opposite, right? We
Mhm.
offer those AP classes, those UConn early college experiences. We want to make sure that our students are appropriately challenged in the classroom in
Yeah.
a supportive way.
I think that's a really great point, Tammy, because honestly, like one of the things that I see happen, most, it's like the first line of defense, at a, in a lot of schools is to say the child has having anxiety. Let's remove some of the workload and let's take the AP class down to honors or down to regular, or let's like remove some of the like the expectations, that the child has. And, for a lot of kids, a lot of these kids are really bright, and really driven, and they derive a lot of self-esteem and self-worth from what they're able to do. And then like taking that away, taking the AP down to regular or whatever is not actually helpful, to the scenario, and to the anxiety. It, could, in many instances make it worse. So, I love what you taught, how you have those high level classes and, and supports. What are other ways in which a school, and Dana and, and Adrienne, if you could, jump in, what are other ways in which a school can support a student with, with anxiety about being in the classroom and about, both social, both academic, different anxieties?
I think if you don't mind if I jump in.
Yeah, jump in.
And I saw this, I think, in the questions too, which is part of it, is another thing that turns into emotional issues is unidentified learning issues. And that's a huge issue for children. And so I find that figuring out the root, like what is happening, is this a result of COVID? Is this a result of a kid who has a learning disability who's been able to get through, but it's tearing them apart. Once we can put the supports in, and that goes back to the evaluation, right? And going back to a comprehensive evaluation that is really digging into what is the root cause of these issues. And so, Dr. Smaller can talk more to that and how you figure out what they are. But, I think that everything starts with an evaluation and how, what is the problem? And then how can we address that? And if it's that a child doesn't know how to read, but they've been able to get through, well, then let's teach the kid how to read and school will be less stressful. I think, but when we get to school refusal, because I know we're talking about that a lot, the hardest thing is once a kid won't go into school, it is almost impossible to get them back to that school. And so if we allow it to get to that place, then we're automatically looking at, I think, at an out of district program, because there's we're going to waste our time and the child's time trying to drag them in, as you said. So the sooner we can catch these things and properly evaluate children who have these emotional concerns, the sooner we can start working on the root of the problem.
Because we didn't talk about that as we were talking about, the causes of anxiety. Obviously there's generalized anxiety, there's social anxiety, there's, all
social skills. That's a huge one. Kids don't have social skills.
But if you don't know, if you have an undiagnosed learning disorder and you are struggling in your classroom on a daily basis, that is a significant source of anxiety that, is, not easily rectified, but is rectifiable, with the appropriate, evaluation, with that roadmap to, where you are and where you're going. Unfortunately, once it's gotten to a school refusal type of situation, you kind of have to triage the school refusal, and in addition to, dealing with the underlying learning disability, for sure.
And in terms of the evaluation, it's almost such a relief if we identify either ADHD or a learning disability, because then the school team is like, they know how to do that.
Right.
They don't know how to do the other. And it's really difficult to get them, particularly in school refusal, to get them to think outside the box. So there are a number of different things that you can do. And it's just, and I think in the last year we were able to manage to get a student back in after a year and a half.
Wow.
And it was really, and I think it was that the school was so panicked about paying for a residential program that they did everything that I could throw at them, basically, to just get Yeah, and so it meant like she would agree to go to the elementary school to start homebound tutoring, and that she was an artist, and so she agreed to go to art class and then go back to the elementary school, which was sort of on the same campus as the high school. But so we had to, and again, the team kept saying, well, we have to increase her debt, and it's like it's got to come from her, in terms of these very small steps.
Yeah.
And she's going off to college next year. So, when push comes to shove and the team is agreeing to think outside the box, it doesn't really, we haven't done this before. And they were a team that kept saying, if you just get her in the car, we'll send a car for her.
Right.
So, it has to be something that's very carefully woven. And I think that Tammy, and what you said in terms of the relationship, that she did identify safe people in that school. And it was those relationships that she was able to be drawn back in and to function in a, in a typical way. But it took a lot of, it took a lot of work. So, and a lot of, parent support by the, treating mental health professionals. And it's not an easy thing to do.
Yeah. You've brought up sort of an interesting, point or angle to all of this, which I'd like to explore, which is, sort of who's responsible for all, because we're sort of at a, at the juncture of, of medicine, insurance, and, special education, the law. So what's, what's the district responsible for? What's, insurance responsible for? How does a parent weave all of this together to get the appropriate support for their child? Obviously, Tammy, a large number of your kids are district placed. Maybe you can start and talk about, that.
Yeah, so again, if about 70% are district placed, these are students that are coming to us on IEPs. So they've already been classified, and we're having a lot of communication with families and districts about how to best support them, but the district is helping to provide tuition and transportation. For students then, the other 30% or so that are privately placed, they might have an arrangement with their district. We don't know the details of that, but most often they are unilaterally placing and trying to find funds to help support their child. Now, what we are willing to do, for example, is there are some tax benefits, right? So you can do tax write-offs. You can also apply for insurance if we pull out the therapeutic, the clinical component of our programming. So we will help educate our parents about some of the options to defray the cost, because it is very costly.
Dana, do you want to, or I'm sorry, Adrienne, you, absolutely.
No, I was going to say, just in terms of the school, within the public school, they will provide, counseling if the IEP calls for that. They, in some cases, they'll suggest a psychiatric evaluation that the district will pay for. And in the case I talked about, that was clear. And there's some concerns about that sometimes when a district is funding a psychiatric evaluation, but also then the district would, if you're requesting an independent educational evaluation, would fund a comprehensive psychological evaluation, but not individual psychotherapy, family therapy, any of that sort of outpatient. Schools do not fund that.
Well, and I do think it's important to note that when we talk about counseling in the public school setting, we're not talking about therapy, right? I hear a lot of parents saying, I don't want them getting therapy at school. And
they don't get therapy at school.
You don't get therapy at school.
Not get therapy at school.
Exactly.
That person has a different degree than,
totally different
than Dr.
degree.
Smaller, completely different degree.
Exactly.
It's not the same thing at all.
Exactly.
Not even in the same ballpark.
No. So, but they can get our social skills counseling. They can get, support in areas which are creating that anxiety. But to answer the question of what are schools responsible for, they are responsible to provide a child an appropriate education. And what that means has been hashed out in many courts. But education is not just academics, not
Mhm.
under the IDEA. It includes social, emotional, and behavioral. So if you're hearing, but they're smart, and if they have mental health issues, it's medical, that's not accurate.
Right.
If it is impacting their education,
Right.
then the school district is responsible. They don't have to pay for you to get a proper diagnosis, and they don't automatically have to pay for a therapeutic setting.
Mhm.
And, when Dr. Moscrip said that, some parents have arrangements with their schools, but they don't know the details, that those are arrangements that I go to with my clients, and we have settlement agreements sometimes with schools, because sometimes parents want their child in this program and the school district's offering that program, and we come up with some agreement. And then the therapeutic piece might be pulled out, and the parents can go to insurance with that. There's sometimes some of these schools do have financial aid. There are other ways to, or some, what's it called, tuition forgiveness or whatever it is. It depends on the program. But so they're not cheap. None of them are cheap.
Mhm.
And there's a reason parents don't just place their kids in therapeutic placements. And there's a reason schools don't want to just place kids in therapeutic placements, because it's the right place to be. It's their budgets are a concern, and that's a reality. So, having as much information to support your position as you possibly can. And again, that goes back to the evaluation. If you don't agree with the evaluation your school district did, you have the right to ask for an independent educational evaluation. And if they agree to that, you get to pick the evaluator, they pay for it. And that can give you, that goes to the neuropsych or to a different type, not necessarily a psychiatric, but there are a lot, you can get a neuropsychological evaluation or a comprehensive psychological evaluation that will give you a lot of the information you're looking for that your school district really can't provide.
Mhm.
So, it's always worth, if you find yourself in that position, you don't know which way to go,
Mhm.
whether you need one or not, I think it's always worth calling a special education advocate or attorney. At least in our state, I don't know of any who wouldn't just talk to you to give you some guidance and
Mhm.
maybe even give you the names of some people to call. We're all really good resources. And so I do always suggest that parents reach out when they're unsure of anything.
Yeah. Because obviously this is a, an area that, spans a lot of different, different things,
Mhm.
you're talking about, sort of the, the interrelationship between, all of these different, the school, the school, the independent school, the provider, the mental health provider, the insurance company, all of those things. And, and I think it's, it's helpful, particularly for families that are, navigating this, for the first time. Hopefully one doesn't have to do it more than once.
Right.
That that they can kind of understand the interrelationship between the different parties. Um, we have just a few minutes left, and and I just wanted to talk a little bit about how to think about best supporting a student with with mental health challenges, with anxiety and depression from a parent's perspective. All of you are parents, and I'd love your perspective on how you think about what you would do if your child was going through some of the things that you see on in your work environment. Some of us have seen it in our work and our personal environment. So, I'd love to hear, what the three of you, think about how to best support a child in this, that's having these struggles as a parent.
Yeah, that's if I could go.
Yeah, absolutely.
It is, you struggle kind of working in the environment, and then we're all parents, and on occasion, yes, your child will face anxiety, right? Like
Mhm.
we all get apprehensive about something. And then, to Dr. Smaller's point, is kind of understanding when it becomes interfering in various domains.
Mhm.
And I think one of the biggest things is, parents really do know their children best. Advocate strongly for your child, and what they look like in the home or with their friends or extracurricular activities, or what the barriers are to them trying to be able to access those things. I think communication with your child is so important, to be able to open the lines of non-judgmental, non-fearful communication. I think sometimes our anxiety becomes our child's anxiety. So if we see them struggling, if we see them challenged by something, right? We want to remove the obstacles. We want to make everything better. Or sometimes, again, we get apprehensive about something and we're modeling then how we respond to adversity and setback and challenge, when in fact, it's not that we don't have fears, right? On some level, they're motivating. But it's important that we can articulate the impact of those and then how to get through them, right? I think the biggest thing, speaking to the school avoidance, is there's this sense of I don't try, I don't fail, or if I can't do it perfectly, I won't do it at all, or I can't do that. Stop, right?
Yeah.
As opposed to recognizing like this might be challenging, this might not be comfortable, but we will get to the other side of it. And each time you develop that resilience, that grit, that confidence to know that, yes, there's going to be a lot of trials and tribulations that life throws my way, but only through managing it effectively, right? By learning about the process and getting to the other side of it, do I recognize, okay, like I can handle this, I can grow. And I think that's really important to role model as parents.
I agree.
Thank you, Tammy.
I think also, I mean, I can speak a little bit to it. I have children who have been in therapeutic schools, so I have some personal aspect to it as well. And I think part of it as a parent is also one, taking care of yourself, because it is incredibly stressful to have a child with mental health issues. I've got 5 kids with all different issues, and I have to say the mental health component, to me anyway, was the hardest.
Me too. Absolutely. Absolutely.
Yeah. And so, it's tough. And as Tammy said, like if we're stressed, we're making our kids stressed, whether we think it or not. And even if we think we're hiding it from them, we're not that good at it. But I think the other perspective or the other piece is changing our perspective that our children are not trying to irritate us. Whenever there is some kind of behavior or issue,
behavior is language.
It's language. There's a need that isn't being met. There is a skill that they don't have. If we can look at it as, if you can turn and look at your child's behavior as not being on purpose, I think that can really change how you address the situation. And I will tell you up front, I am not good at that. It has not been my strong suit, but I do try to remind myself of that when your child does something once doesn't mean they can always do it every day and routinely. So I think those pieces are important to remember, and take care of yourself.
Absolutely. I agree with what you both said. And it's so enormously stressful for parents, I think, to go. And while I'm treating children, I feel like I'm treating the whole family. And it's extraordinarily stressful. And I tend to sort of want to look at those small pockets of what brings that child joy. And going through this. And again, it's nothing of their choosing, but to really sort of look for those small pockets and, keeping your child or making those experiences available. And it's as simple as going for a hike on their favorite trail, but really sort of finding those small pockets that they, that are self-soothing and calming and joyful while they're going through these experiences, with the goal of, introducing just a little bit more and sort of creating that sense of mastery. It's really mastery that sort of fosters that kind of self-esteem and helps to, I feel, bring children out of those periods of darkness. So it's those kinds of things. And I know as a parent, that's what, has worked best with my children. So.
I think, as a parent, just to wrap all of this up, and thank you all to the 3 of you for joining, I think it's always important to think, not only in terms of like, we tend to think about, like fixing the child. And, a lot of the times, it's the environment that needs fixing, honestly. And, I mean, a few of you have probably heard me say this, but, if you have a plant that's in a room, you are not, on the plant about why it won't grow or why it's not thriving. It's always, it's not getting enough sun, or it's not getting enough water, or the soil's wrong, or the pot's too small, or whatever. And, always try to think about, kids that way, in that, you know, it's not just about fixing the kid, it's about, you know, it's about fixing the environment and what's going on in the environment around them that is manifesting in a way that's preventing the child from growing or thriving or whatever. I want to thank all three of you for joining, you know, us this evening on this incredibly, you know, important topic, and for sharing your expertise, your knowledge, you know, and your hard-earned wisdom, you know, in the case of, you know, really all four of us. Thank you so much for joining us. We will have next month's webinar, as I said, will be on preparing for college for students with IEPs and 504 plans. I encourage you to join us for that. And for our Spire and Pinnacle school showcases, which will also take place in April. Thank you so much, everyone, and have a great evening. Good night.
Thank you.
Thank you.